homelessness are able to retain coverage. So we'll go ahead and get started. Next slide, Riley. So before we get into the meat of what we're going to talk about, I just wanted to let folks know we're on a webinar. So you'll all be muted, but feel free to raise your hand and we will bring you off mute so that you can speak and ask a question. We're asking folks to put all your questions in the Q&A feature rather than the chat. And you can see the Q&A feature down at the bottom of your screen. And reason we're doing that is we're hoping to be able to answer those questions in real time. We have a team of folks behind the scenes who have subject matter expertise. So as people are presenting, if you have specific questions about the presentation or clarification or areas of confusion, please use the Q&A. And then we will also have time for question and answers, for commentary, for ideas that you have at the end. And we'll bring people off mute and have a good conversation together. So I just want to make sure folks realize that. And don't forget, if you raise your hand, to not mute yourself. So we'll go on to the agenda. What we're going to do today is we're going to have an introduction from the California Healthcare Foundation. Then we will be giving a little bit of background on Medi-Cal, on Renewals, and how they are impacting people experiencing homelessness. Then the Department of Healthcare Service is here today to talk about the efforts they have made to help support people experiencing homelessness keep their Medi-Cal coverage. Then we'll dig a little deep into our new toolkit and some of the key guidance we have for people who are providing assistance and support. For people who aren't getting their renewal packets in the mail. And then we'll hear a little bit about some of the things that we've been hearing from the community about ways that they are addressing this, creative activities they're doing. And then specifically, we'll hear from one of our providers that we partner with who will be talking about the work that they're doing. And then ample time again for sharing out and questions and answers. So with that, I will pass it to our friends from California Healthcare Foundation. Dalma.
Thanks, Julie. And hello, everyone. It's my great pleasure to be with you all here today. My name is Dalma Diaz, and I am a Health Equity Fellow working at the intersection of homelessness and healthcare at the California Healthcare Foundation. A little bit about us. We are an independent nonprofit philanthropy and work to improve the healthcare system for Californians with low incomes and those who are not well served by the status quo. We are so excited to support this work on Medi-Cal renewals for people experiencing homelessness and are so grateful for the amazing team at Homebase for leading this effort and for all of you today who are here joining us to hear this webinar and to act on the learnings and keep folks covered. Looking forward to all the work that is to come, and I hope that this is a productive and useful time for everyone here. And with that, I'll just thank you again, and I'll pass it back to Julie.
And thank you, Dalma, and thanks for all the support we've gotten from the California Healthcare Foundation for making this a reality and being able to do all the important work that we've done over the last couple months to help bring materials and information to communities to be able to address this specific population and the needs that they have around renewals that are unique and challenging compared to the broader population of folks in Medi-Cal. So let's go ahead to the next screen. So just a little bit about our organization, Homebase, for those of you who are not familiar with us. We are a nonprofit organization that's been around for over 30 years, working to prevent and end homelessness. We do work at a federal, county, and local levels, and our work is very customized and community specific. We do a range of work where we are working side by side with communities and community organizations, as well as providing technical expertise. Sometimes we come in as subject matter experts. Other times we work to come in and do an evaluation or help with strategic planning. One of the key features of our partnering with us is that we really honor local expertise. We work to customize solutions that are specific in communities, and that we highly value the role of people with lived experience of homelessness and their expertise. Today we have for you, this next slide, is a group of us who will be speaking. It's always interesting when you're doing everything on Zoom. You get these teeny little photos, but this is the group of folks who will be talking today in addition to Dalma from California Healthcare Foundation. So just wanted to highlight that. And then we'll go to the next slide. So we're going to do a little bit of background. Next slide, please. On Medi-Cal renewals. So first, sort of stepping back, and most of you probably know this, but we just want to make sure we have a nice level playing field. Medicaid is a public health insurance that covers people who are low income, a range of folks, individuals, families, children, people with disabilities, pregnant women, seniors. And the program in California is called Medi-Cal, and Medi-Cal serves almost 16 million people. What is unique about California, and I want to talk about this a little bit because it really creates the context for why this losing health coverage is so vital here in California, is that we have a more expansive program than other states. One of the more basic ones is that we cover people without legal present status. So immigrants who come into the state, if they're under 26 or over 50, are already covered in California, regardless of their immigration status. And starting in next year, 2024, all ages will be covered. And so what that means is there are a lot more people eligible to get health insurance and also to lose it. Another important piece of our more expansive is really about the services and benefits that are available in California. And because there are more benefits, there is greater at risk of what happens when people lose their health coverage. So let's go to the next slide and we'll give you a really good example of this. So in California, we have a new program called CalAIM, and it's a very broad, expansive program. It was granted to the state of California through a federal waiver to be more expansive than what the traditional Medi-Cal is. And there are many programs. They've created new Medi-Cal rules around people transitioning from the criminal legal system. They extended out the coverage, the length of coverage for people after they've given birth. And so there's a lot of aspects to the CalAIM initiative, but the ones that are really important for people experiencing homelessness that we're going to talk a little bit about today are enhanced care management and community supports. These are new programs and new benefits that provide more support to people with complex healthcare needs, including people experiencing homelessness. Enhanced care management is a way to help people with a lot of things happening at the same time, kind of focus their care, provide them coordinated care. And one of the most important things about that is that they bring the care to the people where they are. So instead of asking people experiencing homelessness to go to a clinic, it allows you to get the care management happen where you are. So maybe in the shelter, maybe in an encampment, so people don't have to deny themselves that care because of the risk of leaving their things behind or their pets behind. Community supports is another program that's optional, but almost all of the managed care plans in California are covering these 4 specific community supports. There's a list of 14, but these 4 are primarily focused on housing. And why we want to raise that here is that not only are people, if they lose Medi-Cal, losing their health coverage, but they're losing access to housing services. They're losing housing-related navigation, tenancy and supports, housing deposits, and post-hospitalization short-term housing. So why this is important, let's say you're in another state, people are losing Medi-Cal, they're losing their health coverage, but if you're in California, not only are you losing health coverage, but you're losing these important housing-related services, and the community is losing these important healthcare dollars that are being leveraged to support these services that if a person doesn't have Medi-Cal, they won't be able to provide. So these are very important and why we wanted to talk about them today. Next slide. So for the last 3 years, federal government had put on hold, pause, the renewal process. Mostly and historically, everyone has to renew whether they're eligible for Medi-Cal every year to make sure they're continuing to be eligible. And often that means they look at what they were when they first applied and they said, are you still eligible? Tell us about your income. Tell us about your family size, any changes in your circumstances. And for the last 3 years, that was on hold. And so many people who were new to the Medi-Cal system during those 3 years have never experienced the renewal process, the traditional every year you have to show Medi-Cal that you continue to be eligible. And so for a lot of people, this is their first time that they have to go through the experience of renewing. And the traditional way of renewing is sending an envelope with a pre-populated renewal package in the regular mail to someone's last known address. And because things don't always go well when things come in the mail, we are looking in California at 2 to 3 million people who may lose coverage over the next year. Some of those people are not eligible for Medi-Cal anymore. Their income is too high. They got a job that has health insurance already. So there are a lot of people who are not eligible and will lose coverage because they have other insurance or other situations. But they're also projecting that about 1.5 million people who are still eligible for Medi-Cal will lose it, even though they're still eligible because of what we call procedural reasons. And that might be they didn't get their packet in the mail, they didn't understand it, they didn't send their documentation in on time. There's a lot of reasons, but being ineligible is different than being eligible and still not being able to renew. And so today we're really trying to talk about focusing on making sure that 1.5 million people who are still eligible gets smaller and smaller, because we're all doing a really good job making sure they don't lose their Medi-Cal coverage if they continue to be eligible. So we'll turn to the next page. Renewal notices come in the mail, and not everyone has a mailing address. And that's really the crux of what we're here to talk about today. What happens when you don't have a mailing address, or what happens if your mailing address has changed, you were homeless, you got a new place, and because you didn't know you had to renew for the last 3 years, you might not have updated the system and told them what your new address is. Next slide. So there are unique challenges for people experiencing homelessness because these renewal notices are coming in the mail, and people who have lost their housing don't necessarily reside there anymore, is that they won't receive their renewal packet. They might not get a notice that they were renewed, or that to remind them that they need to renew. And especially for people who don't use English, oftentimes those notices come with Babel language, which is language in the 13 threshold languages of California that says to the reader in their language of choice, this is an important package. Here's how you can get more information in your language of choice. And they don't have access to those if they don't have a mailing address. So this is really important, particularly for people experiencing homelessness who may not have an address. Next slide. What's at stake? We talked a little bit, losing health coverage, really something vital, a safety net, especially at one of the few safety nets for people experiencing homelessness. They don't have a home, but they have health coverage. Also, those housing related supports that we talked about before, people who are getting support from the Medi-Cal program to help them achieve housing stability. And if they're not on Medi-Cal, they lose access to those supports. People cycle on and off Medi-Cal often for a host of reasons, completely unrelated to eligibility. But what happens when they cycle off and on is that there's disruptions in their care, sometimes results in poor health outcomes. It takes more to reapply for Medi-Cal coverage than it does if you're just renewing. And so not only is it harder to go through that process, but it costs our system more. It takes longer, it costs more, it takes more human resources, it's more stressful. And so people experiencing homelessness are especially at risk of not renewing their coverage and being in that category that I spoke about earlier of the 1.5 million people who may still continue to be eligible, but for some reason lost their coverage. So we're here today to talk about how we as a community can do our best to prevent this from happening, that those people that we work with who are experiencing homelessness, who aren't getting those envelopes, are still able to retain their health coverage and help lead them to more housing stability and more stable lives. Next slide. I'm going to hand it over to Catherine, who is going to speak a little bit about some of those creative ways the state of California is helping make sure that people don't lose health coverage. Catherine.
Thanks so much, Julie. And we can just go to the next slide. Thanks. I'm so happy to talk to everyone today. Really excited to be here. Before I jump into a few of the items that DHCS has specifically for individuals experiencing homelessness, just wanted to go over just some reminders. We did talk about this already. Julie went over this great information, but as we've talked about, individuals experiencing homelessness will have those unique challenges, especially when it comes to accessing information quite equitably and stuff. So just wanted to share some tips to ensure that members don't lose coverage unexpectedly. Now, things happen, we totally understand, but just some general tips. Local county offices are really going to be the place to go to ensure that updated contact information is received. There's a little link, and thanks, just put it in. I think it just got put in the chat. On the DHCS website, local county offices can be found really quickly. Additionally, creating an online account at keepmedicalcoverage.org, you can receive reminders, access case information, and actually upload documents, any documents that are needed. And then making sure that members have reported to their local county office if they are experiencing homelessness, not just for any eligibility related purposes, but it helps counties when doing case review. They might, if they see that an individual is experiencing homelessness and it's in the case record, they might have some creative solutions at the county level on how they reach out to those members. They might have some extra abilities to be able to try and do their best to either have some additional flexibilities or reach out to that member. Next slide, please. Oops, can you go back one? Yeah, thanks. So when possible, county offices, they are the ones that determine eligibility. They will try to renew coverage using all information available in the case file and any sources available without contacting the member. So not everybody is going to receive a renewal packet. Sometimes we've got everything we need, or counties do at least, and they can just go ahead and finish that renewal without outreach. And so that whole process is called ex parte. And when we don't have to reach out to the member, you might see that referenced in other places as auto ex parte, because it's just done automatically. We don't need any additional information. However, if it's not successful for whatever reason, we weren't able to verify their information that we needed for eligibility, the member may receive that paper renewal packet in the mail. But just because it's received in the mail, the packet can be completed over the phone if they create that account online or in person at their local county office. It does not have to be sent back in the mail. They can bring it in. They need help. They got a question on it or something, bring it into the local county office. They can call them up, anything like that. So there are different avenues if they have that renewal packet, but we do have some flexibilities to really help this process as well. So we can move on to the next slide and I will go over those. So during the continuous coverage unwinding period, the Centers for Medicare and Medicaid Services, which is the federal oversight agency over DHCS, and then DHCS oversees our counties, they really provided states with various strategies to reduce Medi-Cal terminations, but also as a side effect of that, also help reduce workload burdens on both the county side and the member side, because we are seeing, unprecedented levels resuming these renewals. It's a huge workload lift. We've had tons of staffing changes at the county. We have new workers. We have staffing challenges, which is nationwide in various areas. So really wanted to help have different strategies just to help reduce those terminations and help support members as well as eligibility staff. A lot of these flexibilities have already been utilized by California. I am not going to go over all of them. It would take me a little bit too long to go over all of the flexibilities, but you can find them on the DHCS website. But I wanted to highlight a few in particular that are going to be the most beneficial, and kind of for us when applying, we really thought these would help our members experiencing homelessness the most. So next slide, please. So there's actually 3 waivers on here, but 2 of them we kind of combine because they're very, very similar. So these waivers all really help reduce the paperwork that's needed and can really streamline the renewal process or the eligibility process. The first 2 we call zero income waiver and income under 100% of the FPL waiver. So for both of these waivers, basically, if anyone has income under 100% of the federal poverty level, eligibility can be renewed to members that have attested to that income level. They typically, in like a normal setting, if we were not able to electronically verify that income, the county would reach out and request pay stubs or whatever income that they have, request proof of that income, or if they're attesting to no income, some sort of written document that says, hey, I attest that I don't have, under penalty of perjury, that I don't have any income, because the county was not able to verify that. But these waivers just allow us to bypass that process and go through the renewal process without requesting additional verifications. Because sometimes what happens is people complete the renewal process, but they don't have that pay stub, or they get confused, or whatever. And that really streamlines. These also are being automated in our system. So this was a little bit of a manual process, but as of this month, these are both going to be automated in the systems. So when the systems are being run for eligibility, it'll detect whether somebody has no income or income under 100% of the federal poverty level. And if everything else is good to go, there's nothing else that's needed for eligibility on the case, that case will go forward and that person's renewal will be completed. The second waiver is also really, really exciting, and especially for individuals experiencing homelessness, and it's called our Redeterminations for Hard to Reach Populations Waiver. I think we can categorize individuals experiencing homelessness as definitely hard to reach. They have, difficulty maybe having reliable access to phone or email or internet or whatever. And so anytime contact is made at the county level with an individual who's considered hard to reach, and we've defined that very broadly so that a lot of people can fall under that bucket, counties can go ahead and conduct what we call a change in circumstance redetermination. So it's not a renewal. They're not going to have to complete the renewal packet. The counties can just say, hey, you called me to report your address, mailing address changed, or a new phone number. Hey, well, I have you on the phone. Did your income change? Have you had any life changes, like get married or had a baby or anything like that? The county will just do a quick check, see if there's anything else. And if everything's good to go, nothing else is needed, the county will just go ahead and conduct what's called a change in circumstance redetermination and move the renewal date out an additional 12 months, and they won't have to complete that renewal packet. So it's kind of catching people as they come in, maybe for other related matters when it's not really their renewal month, or maybe it's about to be their renewal, catching them when we've got them, because we might lose contact with them later. So really trying to make sure that while we have contact, we have a one touch with them and not having to go back and forth with renewal packets or questions or anything like that. So those are the really exciting flexibilities that we have, along with many others that I haven't had time to highlight here. So we can move on to the next slide. All right, so just in case you're not aware, we have DHCS coverage ambassadors. I like to just send this out to everyone. If you ever want any updates on things coming up in the Medi-Cal program, please go ahead and join the DHCS coverage ambassador mailing list. We also have an outreach toolkit if you have an organization where you might want to use any of our toolkit items. Go ahead and you can access those from the ambassador website. And next slide, please. And these are just some of the resources. I saw most of them went in the chat, but just in case anyone wanted any additional ones. That last one is the one I haven't gone over, which is the DHCS Continuous Coverage Unwinding Plan. And this is a very hefty document, but it's got all of our federal flexibilities that we've applied for. So it's going to contain a lot of the meat and potatoes of things that I was not able to cover today because we don't have 3 hours to talk about the unwinding and all of our various efforts. But please check that out if you're interested. And with that, I will hand it over to Julie.
Just one question, I think, for clarification that came in Q&A is, do counties have the discretion to determine who qualifies for the hard to reach renewal waiver? How does that work?
Yes, counties do have the discretion, but we've really defined it very broadly. It's not just individuals experiencing homelessness, because we do have counties who have very rural populations that maybe struggle with having reliable like cell phone coverage and stuff. So we've made sure to let counties know, especially for their own unique populations, that really we define hard to reach very broadly, especially in this day and age where people screen their phone calls, and that even though they might have reliable coverage, they're still difficult to reach, even if they're not having any sort of life circumstance that makes it actually hard to reach.
Oops, sorry. Thank you so much, Catherine. I think we're up for Alyssa now. Thank you. And Catherine will stay on the call so that if there are more questions for DHCS at the end, she'll still be here to address them. Alyssa.
Great. Thanks, Julie. Thanks so much, Catherine. And thanks for really all the tremendous effort to make sure that people experiencing homelessness can go through this process more easily. So hi, I'm Alyssa Weiss, Directing Analyst here at Homebase, and I'm really pleased to walk us through the Homebase Toolkit and the key steps you all can take to keep Medi-Cal members experiencing homelessness covered. Next slide, please. Thank you. We wanted to create guidance that goes deep on how to support people experiencing homelessness through this process. And we are really pleased to share that we launched a toolkit late last month to do just that. There are 11 distinct tools for providers, people experiencing homelessness, and Health Enrollment Navigators. You can find it all on our site, where we have one link to all the tools or broken down by audience. And all of it is really designed, as Dalma said at the beginning, to help folks understand both the policy circumstances, but then really to take action in their own communities. So next slide, please. We'll just give you a preview of what the site looks like. Next slide, please. And I'm going to dig in today on 3 of the tools, since they're really the most in-depth, and we wanted to go through the content together. So Medi-Cal Renewals, just really understanding the process and its impacts, how to help your clients experiencing homelessness keep their Medi-Cal, and how to support your client if they're having issues with their Medi-Cal renewal or they lose coverage. So with that, we'll dive in. So Julie and Catherine covered some of the basics of the renewal, but I'll just repeat a few key details here. So first, every member has a different renewal date, which will be roughly 12 months after they first enrolled or renewed. And that's why the state is redetermining people kind of over the course of many months, because they won't be able to get to everyone at once, because not everyone will come up at once. So there are 2 different kinds of renewals. One, as we covered, is automatic, also known as ex parte renewal, and manual. So those automatic renewals, California and every state has to try to renew a member's coverage using the information that they have. So that could be data about, somebody's CalFresh information, or by pinging the IRS for income data, or through one of the waivers that the state just described. And if that happens, then the member doesn't have to do anything. Hopefully, they'll get a letter or notification saying that they've been renewed. If that doesn't happen, however, they'll go through this manual renewal process. So if Medi-Cal can't automatically renew, they get that yellow renewal packet in the mail. We'll talk more what happens if you don't have access to the mail, and they have to return that packet and share any information, changes of income, change in circumstances within 2 months. And so, they should be sure to return that packet by the deadline included in the county request. Now, again, I'm sure you're thinking, I thought we said that people probably don't have access to mail if they're experiencing homelessness. And we'll spend time talking about that next, but we really wanted to just provide those basics. Next slide, please. Thank you. So Catherine went through this in depth, and I will just cover this quickly again to reiterate that there are these two special rules and waivers that may hopefully simplify the renewal process for people experiencing homelessness. One, again, is that if an individual is very low income, they may not have to complete that renewal packet at all through the ex parte renewal process. And the other that is if the county knows that an individual is experiencing homelessness, they can do that expedited re-enrollment. But this likely requires the individual to contact Medi-Cal. The state really isn't, the counties really aren't using additional data sources like data from HMIS to understand if somebody is homeless. Now, the other issue here is that this is a reminder that then they'll, like all people, will have to renew again. We are spending a lot of time focused on this issue right now because nobody's had to renew after 3 years, but this process is an annual process, and this process will always jeopardize the healthcare coverage of people experiencing homelessness. So while we're focused on this now, we'll be thinking about it all year round in the years to come, and hope to work with you all to make sure that the folks you serve maintain their Medi-Cal ongoing. Next slide, please. So we put together a few tips about what you can do and what your clients can do to prepare themselves to renew and set themselves up for success. These are some tips we've identified, and we really want to hear from you in the kind of open discussion session if there are other key things you're doing that you found to be successful. So first, you want to find out if your client is on Medi-Cal and what their renewal due date is. So you might do that by looking in HMIS to see if a copy of their Medi-Cal card is uploaded in their files, asking the client directly if they have a Medi-Cal card. If they have if they're not sure if they have Medi-Cal, they might know their managed care plan, and that can help you kind of figure it out. Or calling the county Medi-Cal office. The goal, again, is to really find out the name of the managed care plan, their number, their client Medi-Cal number, and ideally their renewal date. Next is to identify mailing options. We have discussed that a lot of the notices and renewal packets arrive by mail. And just because somebody is experiencing homelessness doesn't mean it will be impossible for them to receive mail. Maybe your facility accepts mail for clients. Maybe there are providers in the community that can start partnerships so that they can collect mail on others' behalf. Even if your client won't be living permanently in their current unit, you should encourage them to provide the county with that current address, and then help your client update their contact information, whether it's email, mailing address, phone, anything they've got with the county. Next is we are really encouraging folks to forge relationships with Health Enrollment Navigators. These are folks who are experts in helping people renew or apply for Medicaid and can troubleshoot issues with clients. They work in different languages. They work in every county. They are truly an invaluable resource. Maybe there are ways to bring navigators on site to a shelter, to an encampment or housing facilities, or have them join street outreach or street medicine efforts. That's, again, just a really valuable relationship. Next, determine if they qualify for the special waivers that we've discussed. And if you're seeing that they're not, but you think that they should, you can advocate to the county on their behalf. Because again, that automatic process is going to be a lot easier than filling out a renewal. And then you can help them prepare to access personal documents. In the renewal process, your clients may need to share personal identification and documents with the county. You can help your clients make a plan to access and gather their documents, or you can check your systems to see if you have access to any of those documents, like documentation of their current income. Next slide, please. So somebody raised in the Q&A, some folks don't have access to email, and that's totally true. And so what we wanted to do was put together ways to renew, knowing that some people may not have access to, a cell phone, to email, to internet, to mail. And so there are different options depending on what people do and don't have access to. So we'll kind of walk through that. So again, first is checking to see if your clients were automatically renewed through waivers. And if not, there are a whole bunch of ways to apply, and you can work with your clients to figure out what that best option is going to be. So again, first, if possible, help folks set up a mailing address. And then if they did that and then received that renewal packet in the mail, they can complete it. They might need some assistance, and then mail that completed renewal form back to the county. Another option is to create a Medi-Cal account online where they can learn what their renewal date is. They can check information. They can submit the renewal. It may be a little tricky to set up a Medi-Cal account online, and people experiencing homelessness may benefit from assistance from providers in doing that. Lastly, they can call or visit in person their local Medi-Cal office to renew directly. And we're hearing this in California, we're hearing this nationally. There might be long wait times, but that is a viable option. Next slide, please. Just a few tips. So the first is to say that members cannot complete a blank form. So it has to be personalized to the individual. So if they never got their form in the mail, they can't just find a blank one and send it in. They have to get that personalized renewal form by calling or going in person to their county Medi-Cal office and requesting their renewal form or setting up that account online. If you wind up calling the county to help a client, they have to be present with you or on a three-way call. You cannot call just on their behalf without that client present. Already said this, but if you're going in person or on the phone, prepare for long wait times. And again, just another plug to reach out for those health enrollment navigators for assistance. Next slide, please. So what can you do if there are challenges or their Medi-Cal is terminated? First, it is really important to know that coverage can be reinstated up to 90 days after termination in what is known as the cure period here in California. Clients can ask the county what information is missing, and if it's within those 90 days and they can share that information back with the county, they can submit a renewal as opposed to a full application, which is much easier. Next is, if they think that their Medi-Cal was ended in error, they can ask the county for a Medi-Cal fair hearing. Clients normally have to file for a fair hearing within 90 days of learning of their coverage termination and receiving a letter from the county. But currently, during this time period, they have up to 120 days after receiving that notice to request a fair hearing. They could also contact legal aid. Health Consumer Alliance is working across the state on this issue, providing free confidential support to folks in this process. And finally, if somebody loses their Medi-Cal, they should reapply, either again for Medi-Cal or Covered California. Next slide, please. And these are just kind of all the resources in one place. We'll add these to the chat as well. Those wonderful resources from the state, keepmedicalcoverage.com, how to create an online account, that list of county Medi-Cal offices, the local list of Health Enrollment Navigators, and information for Health Consumer Alliance. Next slide, I believe I'm turning it over to Riley.
Alyssa, before we turn it over to Riley, can we just get a couple, there are a couple, not clarifying questions, but points of emphasis that would be good for you to just go back over a little bit about the process, the time frame between when they find out they renew to the point where they have a deadline. And then also maybe a little bit more on how to help, the troubleshooting, how to help in terms of what you can do online versus actually, I think most of the questions were about the process to help online.
Sure. So the first, I'm not totally sure I'm knowing all the questions, but I think the first one is that the notice, folks will receive information about their renewal date roughly 2 months before that deadline. And so that's the time to collect the information that the county is asking for, send it back to the county. So it's about a 2-month process. Is that answering the question, Julie?
That is, yes. Do you want me to
Okay.
take the second one that I was rambling on?
Sure. Yeah, go for it.
Okay. So the questions were, it seems to be questions about how to use the online system. And so just to talk, some people may already have an online account. And so when they come into your office, you just might want to sit down with them and sign in, and it should show them when their renewal date is. So that's one piece. The other piece is to help people actually create an online account so that if they don't get the package in the mail, they at least know they get a notice online that you can help them check to know that that 2-month period started. And so you might need to help them get an email, right? They may not have an email. So you might have to spend a little bit of time helping them get an email. You don't want them to use your email because then you're going to get their notice. You want them to get an email so that they can sign up. And then after they sign up, it takes anywhere from an hour to 24 hours. They should be able to then go back in and sign in and see when their renewal date is. So that's one area where we're recommending for people to make sure they have an account. You can update your address. You can get a possible address from a shelter or a day center that you can use to get your Medi-Cal. So we think all of that online makes that a lot easier, because once they have an online account, a lot of that can happen online, and you can actually help them renew online.
And I just added our tool on how to create an online account. The intended audience there is people experiencing homelessness, but obviously useful for anyone. I think, for folks who are able to create and maintain an online account, it's a great option, but we also know that's not for everyone, which again is why we wanted to give a whole bunch of options depending on what folks are comfortable with and have access to.
Thank you, Alyssa, and thank you, Riley, for letting us sneak those questions in.
Yeah, of course. And I just want to say it's amazing, like how many questions we've got throughout this presentation. It's really great to see how engaged you all here are today. And we're glad to answer any questions in this webinar, but also after this presentation, Homebase will always be here to help you understand our toolkit better and help you kind of navigate the renewal process. All right, so now I'll introduce myself. I'm Riley Meave from Homebase. I'm a research associate, and I've had the pleasure of presenting for several different communities at COC meetings and service provider meetings and mainstream benefits trainings, you name it. That is maybe where you heard about this statewide webinar, because we wanted to make our presentations accessible to all communities. And from the local community presentations we've been doing over the past month, from those meetings, Homebase has gotten a glimpse into how communities are taking action to help people experiencing homelessness renew their Medi-Cal. So on this slide, I've provided a few examples of how any community can take steps together to bring awareness about renewal barriers for people experiencing homelessness and how to effectively help people experiencing homelessness navigate renewals. And these examples on this slide emphasize the importance of cross-system partnership, during this unprecedented renewal period. And first, in several communities, we've heard of many homeless service providers offering their mailing address to clients of other providers in their community. And then in one community specifically, it was suggested that mailing services at a community center be utilized kind of as the home plate base camp for receiving Medi-Cal information for clients in that COC. Second, we've heard some rumblings in communities about hosting all-day events to support clients through renewals by having commuters on hand, to help individuals update contact information and make online accounts, and also using that time to determine when a person's renewal may be sent and due. And one community suggested inviting Health Enrollment Navigators to help at this event. Homebase has some information in the toolkit about how to build that partnership between providers and Health Enrollment Navigators, and where both navigators and providers can find each other and locate each other's information.
And another community suggested inviting the county Medi-Cal office staff to help with this event. And that kind of relates to another idea we've heard of. Many communities have expressed an interest to get in touch with their county Medi-Cal office after hearing our presentation, and they want the county office to join them for an upcoming COC meeting. And that's because renewals, as we've talked about, are processed at a county level, and it's a great idea to get to know the local processes from the county themselves. We're still in the beginning of this renewal period. We kept these examples on the slide general without spotlighting a specific community because most communities have not had the time yet to fully execute these plans, but Homebase really wants to stay informed about the unique approaches providers and communities are taking to keep people experiencing homelessness covered. Through this campaign over the next year, we do want to try and cultivate a peer sharing process between communities across the state, and we can keep DHCS updated about what is and isn't going well in your community. I'm about to pass it off to my colleague Carla, and Carla will later be facilitating a Q&A portion of this webinar after we invite a guest speaker to speak. And the Q&A, I just want to mention, is a great opportunity to share what other ideas or plans your communities may have, or also what barriers you've faced when trying to create ideas like this to uniquely help people experiencing homelessness renew their Medi-Cal. And with that being said, I'm going to pass it off to Carla, who's going to introduce one of our guest speakers.
Thank you so much, Riley. So yes, my name is Carla from Homebase. I'm really glad to be here today and really happy to introduce our next speaker, Lily Dorn, who is a legislative affairs specialist at the Community Clinic Association of Los Angeles County, where she represents the interests of LA area community clinics and health centers and the people that they serve. And so Lily is going to cover the sort of outreach strategies that the Community Health Center in LA County have been deploying to keep people enrolled in Medi-Cal during this process. So Lily, I'll pass it on to you.
Thank you so much, Carla, and good afternoon, everyone. Great to be with you all. And my goodness, there are so many resources being shared here today. So I certainly appreciate it, and I'm sure all of you do. I think really wanting to elevate, the clinic perspective, recognizing CCLAC, and that's quite the acronym. Try saying it 10 times super fast, not too fun. But, we represent, as Carla mentioned, if we go to the next slide, we represent 66 community health centers and clinics that operate over 350 sites throughout the county. And those clinics serve roughly 1.8 million patients each year, most of whom are covered by Medi-Cal. Most of the patients are uninsured. I think we reach about 75,000 people experiencing homelessness each year. So, as Carla mentioned, CCLAC really serves as a conduit and an integrator of resources to really support our experts on the ground, our members, who are doing the tireless work of making sure that, these meaningful program expansions within the Medi-Cal program translate into meaningful access on the ground. If we go to the next slide, we just wanted to highlight sort of the patient population. And as you'll see, 92% of the patients served by community health centers are either covered, 64% are covered by Medi-Cal. And you'll see that the largest second percentage there are folks who are uninsured. And then as I referenced earlier, a lot of the patients that we serve are experiencing homelessness. We go to the next slide. We did want to include this handy tool. So for folks in Los Angeles County, this may be a helpful tool for you. It allows you to enter your zip code and find the nearest clinic site. So pulling data from our member and affiliate clinics, you can find out what clinics are closest to you, what services they provide, and get the help that you need. If we go to the next slide, we did want to just sort of leverage some of the expertise on the ground from our members here today. I can't cover it all, and I certainly encourage you to reach out to me, and I'm happy to connect you with any of our members, and we are here to partner with you in this really important work. If we go to the next slide, we did want to leverage some of the strategies in place. As so many of my colleagues raised here today, leveraging Health Enrollment Navigators is a key strategy in really helping folks retain their Medi-Cal coverage, specifically this population. Really looking at the Navigators project, this is a state program, and so there are clinics that contract with the county, and they provide specific enrollment and outreach efforts to help folks stay covered and to get them enrolled in other programs beyond the Medi-Cal program. And so really what's happening now is DHCS is providing these entities that are part of the Navigators project with some really critical data. Medi-Cal members who need to complete renewals within 2 months' time. And then, obviously we do not want folks to lose their coverage, but as mentioned here earlier, we have flexibilities in place if coverage is terminated. So that second data point you see there, the disenrolled Medi-Cal members who have 90 days to reinstate their coverage with that 90-day cure period flexibility. So I included the links to, view the list of these health enrollment navigators that partner with their counties across the state. You can access that there. And then in LA County, the group of navigators that our county works with that include some of our member clinics. If you go to the next slide, we just wanted to highlight, so this is specific to LA County. You'll see here, we did include a QR code as well. You can access the full list of, we call that program here in LA County, the Community Health Outreach Initiative Program. So all of those organizations that are a part of this program providing these robust enrollment services to folks are included in this flyer linked on the slide, and it's broken down by SPA, so service plan area. If we go to the next slide, we did want to also leverage street medicine providers. So as all of you I'm sure know, under Medi-Cal, street medicine services are now a reimbursable service. And so what our health centers are doing essentially is really leveraging those providers to get the word out around renewals. So we've actually been partnering with our health plan partners and other CBOs. One key partnership I do want to call out is with LA Care. They have provided a street medicine providers toolkit, and this is a toolkit to specifically assist street medicine providers with outreach to people experiencing homelessness. So these are folks that are going into shelters and other permanent housing locations to provide timely care to folks experiencing homelessness. So really making sure that these providers have the key messages that were elevated by DHCS and the Homebase team earlier. If we go to the next slide, we just wanted to provide a few scenarios around reinstating Medi-Cal coverage. So again, really wanting to highlight that relationships with your county eligibility offices are really critical throughout this process, really understanding what rules, sort of how they're implementing the flexibilities at the state level locally. I think that's key. So really cultivating those relationships so that when folks actually need to use those flexibilities, you're aware of how your county would abide by those different scenarios when they're happening. So for example, you've got the state hearing flexibility, which allows folks to request one if they feel their Medi-Cal will be terminated. So this is an example here, just showing you how simple the process can be on the ground. And then the 90-day cure period flexibility as well, really wanting to highlight the use of a sworn statement. So the counties must accept a sworn statement within that 90-day cure period to reinstate one's coverage. So what that means is as you see here, Oscar may have his Medi-Cal, and let's say his Medi-Cal was terminated on September 1st, and he could not turn in proof of employment at the YMCA. So it was terminated. He has until November 30th to submit a sworn statement. So he can call the county and submit his sworn statement over the phone, and the county must accept that under current flexibilities and reinstate his coverage. So just showing you how that looks. And if you run into issues, we can also, and I'm sure this is included in Homebase's toolkit, but the Healthcare Consumer Alliance has a really great group of legal providers that can really step in and address any issues where coverage is terminated wrongfully. I think I'll stop there. Certainly encourage you to reach out to me, and thank you for putting my email in the chat, Riley. I think that's my last slide. Oh, perfect. Just wanted to leverage a local network that we have in Los Angeles County, the Benefits Access for Immigrants Los Angeles Network. It's a group of navigators, promotoras, community health workers, legal service providers to really make sure that we have a robust referral network in Los Angeles County. I certainly invite you all to look at the links provided here. We have a flyer on redeterminations, and you can also look at the website there.
Thank you so much, Lily. Appreciate you sharing the strategies that are being deployed in LA County to keep folks covered on Medi-Cal, especially during this renewal process. We appreciate you. So now we're going to kind of move into our Q&A and share out portion of today. So because of the number of the folks that are on the call, we're going to ask that folks kind of indicate that they want to ask questions in two different ways. One way that you can do this is by raising your Zoom hand, and we can go ahead and unmute you in the order that you raised your hand, and then you'll be able to speak and ask your question. Or you can continue utilizing the Q&A function, and our team will continue to do our best to keep up with the questions and respond, and we can do it that way. So one of the things that we did want to hear from folks, though, in addition to all your questions, is sort of hearing about how Medi-Cal renewals are going in your communities. What have you seen when you've worked with clients who need to renew? What issues have you been encountering? We'd love to hear that and take this opportunity to hear from you all about what's happening on the ground, and then also to answer any questions that you may have.
Carla, there's a couple questions that I asked people to save for now, and I can read a couple of them, and many of them are for DHCS. So Catherine, if you're still here, I'll start with one, which is someone asked if low-income individuals who don't have documentation between 26 and 59, they will be able to receive Medi-Cal full scope, and that for the folks 50 plus, they'll be getting Medi-Cal 50 plus. Is that right? I think I asked that
Sorry, I had to
question.
make sure I was unmuted. We do have the adult expansion program going in. That's not my area of expertise, so I might have to take this one back to confirm or reach out on the side.
That sounds good.
Thanks.
Another question we had, sorry, I've got to find all of them. Why don't we take another question, and I'll gather the ones that came through that we asked people to hold.
Julie, I just want to say, just for the whole group, because we've gotten this question a few times, we will be sharing the webinar, the slides, and all the resources via email later this week as soon as the recording's ready. So just so folks know that that's coming your way.
Okay, I have one. You ready? Catherine, this is hopefully for something that you have the answer to, but can also get back. For people who were on limited scope coverage Medi-Cal, when that changes in 2024, will they have to reapply or will they be converted to full scope?
I do not believe they will have to reapply. I'm pretty sure there's either there's an automated run that people will go through in the systems that will convert them over. I'll confirm with our adult expansions meet right now and hopefully have a response during this.
Thank you. Why? And then another question is, why can't clients complete a blank Medi-Cal renewal form?
I was actually just reaching out on that one because I was like, oh, I wasn't aware of that one. I confirmed actually, we do have, DHCS has blank renewal forms on the website. The pre-populated forms are not a requirement for Medi-Cal members to have. It's more of a requirement on the DHCS side or on the county side that they have to send a pre-populated form out. But if the member is not able to, if they didn't receive it, they can complete a blank renewal form. It's going to take a little while. It is a little bit of a long form, but they can complete a blank renewal form. It is not a requirement that they have to complete a pre-populated form.
Great, thank you. That's a really important clarification. Thank you so much.
Catherine, can you share a little bit more about the state fair hearing process and what that might look like, or what the client has to show or talk about with the county?
Sure, I'll share a little bit from what I know about the fair hearing process. So on the back of any notice of action that they'll receive, there'll be some information, you know, if you don't agree with the decision that's been made, you can reach out to your county and request a fair hearing. If they request a hearing before the action takes place, which is usually at the end of the month, then they will continue in their coverage if they're going to be terminated or something like that. They'll be held in that coverage during the renewal or during the fair hearing process. And typically in counties, they have specific specialty fair hearing representatives that once they file a hearing, that case will get escalated through the county from the county eligibility worker over to a fair hearing representative. They'll look at the case because a lot of times it's because of an error or just a process, or maybe there was just a system issue that something didn't get marked right or something like that, that it can be remedied at the county level and it doesn't actually need to go through the hearing process. So a lot of times it can be resolved at the county level and just through case review of a specialty person reviewing it. If it is something that maybe was a policy decision that they don't agree with, then once they file a fair hearing with the county, and the county will work to get it scheduled with the state, because the state fair hearings department has judges that travel throughout the state and hear Medi-Cal cases as well as other programs as well. So they'll work with scheduling and all that type of stuff, and then the judge will kind of hear both sides and make a decision whether the county was following guidance or whether they were not adequately following regulations, and if they need to reverse the decision or do some other action. I hope that was helpful. Let me know if there's any more questions.
Catherine, there is another question. What happens if you have someone who's unhoused, who has no social security card, no ID at all? How do they attain Medi-Cal?
So they're able to, if they don't have any documentation whatsoever, the counties have affidavits which just contain usually a blank area for the person to fill out, and they can just attest, I am who I say that I am, I don't have a social security number, I don't have my social security card, etc., and provide as much information as they can. And as long as they attest, that's kind of the last resort. If they don't have any documentation available, the county can accept that signed sworn affidavit. It can also be completed over the phone as well. Counties can capture telephonic signatures as well, and they can use that to go forward with the case and do as much as they can with the information that they have available.
Thank you.
Wanted to come back with a clarification after you said that folks can fill out a blank renewal form. Somebody said, so as an outreach worker, can an outreach worker bring a bunch of forms out to the community, help people fill them out, and then return them? That is allowed.
Correct. Yeah.
Great.
If you have a bunch of blank renewal forms, maybe people are having issues or they don't have their pre-populated form anyways, and they just would rather sit and have help filling it out, that would be fine too.
Perfect.
And there was a question about, is the renewal form the one that's 22 pages long?
The blank one, I believe, is 22 pages. And then if the pre-populated forms will not display things that don't need to be displayed, potentially, it's very dynamic. So some questions might not show up, while some might, or depending on if there's a lot of people in the home, it might be more than 22 pages. But I believe the blank one is that 22 pages. It's just once it's pre-populated, it might vary on the length of how long it is.
So, Catherine, this is Julie. So if I'm an outreach worker and I want to try and get a pre-populated one for someone who didn't get their yellow envelope because they don't have a home address, is it reasonable to reach out and call Medi-Cal with my client with me and ask for them to resend or send to a different address the pre-populated one?
Correct. Yeah, the county can reprint the pre-populated form at any time. It's in their system, so they'll be able to regenerate it. And if you have the member with you, then they'll be able to give that permission to the county to change their address and stuff like that, or
Right.
at least send it to a new address.
So I think the advice is see if you can work with your client to get a pre-populated form, reach out to your agency if they haven't received one. Can they create an online application, an online account, and pull down a pre-populated renewal form from their Benefits Cal website?
That I'd have to double check on. I know once they create the account, it'll populate, once all the information syncs, it can take up to a day or so for the information to populate. I'm not sure if they can reprint it out from there, but I can double check on that.
Great. I think we covered all the questions that are popping up in the chat. One person had a question, and this is to the whole audience, not just to the speakers, but if folks have thoughts about how to do outreach for college students that are homeless, and if anyone's working in a community where there is a focused outreach for college students, we'd love to hear from you.
And just a reminder that you can, if you raise your Zoom hand, we can actually unmute you. So if you'd like to speak, if that's faster or easier for you, please feel free to.
You may be charting new territory, so definitely reach out to us at Medi-Cal at homebaseccc.org as you come up with a good campaign and let us know so we can share it with everyone else.
Just say, I know that a lot of colleges and institutions are increasingly have folks on staff, and apologies if you're one of these people and looking for more assistance, but they do have offices and folks on staff who are thinking about the broader needs of students. And so if you are a provider and don't yet have a relationship with your local college or community college, there should be people you can identify and work with from that campus who are thinking about these issues. And and as Julie said, we'd love to hear about it and support you however we can.
And along those lines, someone wrote that that in Placer works with Sierra College Basic Needs Program, and they have a close working relationship with them. So if they have a homeless student, they can reach out, and then they're setting up 2 days a week to have a worker at that basic needs center. So a great strategy there that can be utilized to help students stay enrolled in their Medi-Cal.
Catherine, we had one more question, which you may or may not know. Can an F1 visa student apply for Medi-Cal?
I will take that one back. I'll have to confirm.
Okay. That might be a good question to ask the Health Consumer Alliance also. Someone asked, is it faster to call your local county number or the general 800 number? And I can speak to, as Riley said, we've been doing a lot of these presentations, and it really depends on which county you're in. So I would, I don't have the answer for you, but we have worked in some counties where the local number has a 5 to 15 minute wait, and the 800 number has a couple hours. So it really depends on what your county's doing and how fast they're able to turn stuff around. There's another question in the chat for Catherine. Sorry, it's so quiet. For folks who don't have a social security number, but they have Medi-Cal, they should just be getting the renewal notification because they're already in. Is that correct?
That's correct. And with the automation of some of the income waivers, they may be auto renewed, just depending on if they meet the criteria for the automation. Social security number was not a required element for our automation efforts. Since we do have that adult expansion coming up, we wanted to include that population as well.
Carla, we have a hand raised.
Good afternoon. My name is Mehdi. I'm the Coordinated Access Navigator Supervisor here at Elika Health Center. We are in Sacramento. I have a question regarding folks who have been referred to community support. Now, with the renewal of their insurance, that might cause, I believe from what I've heard, might cause some issues. But would it be possible for the provider who are actually working on the ground with the client to help them avoid that issue beforehand? Say, for instance, they are referred for housing transition navigational services, and that provider is actively working with the client. Would it be possible for them to help them renew that the insurance before it gets expired?
Yes. Yes, hopefully they come to this, they're on this webinar, or you tell them, recommend that they watch the webinar when we make it available, but they can help people renew in the same way that you can. And, you know, they can offer to help them create an online account. They could call Medi-Cal, or they can reach out even to the managed care plan that they're working for and make sure that they're helping people stay covered. Hope that answers your question.
Yes, thank you.
Awesome. Catherine, we had a question about interpretation services to help people apply or renew for Medi-Cal. Do you want to talk about what DHCS offers or what the local agencies offer?
Absolutely. All counties have interpretation services available, whether it's in-house county staff that can speak, whatever language is being requested, or they all have access to interpretation services through the phone, where sometimes you get the interpreter on the phone and kind of go back and forth with that. But all counties do have that available.
We also have a question. Someone asked, we had a minor who was experiencing homelessness, who wasn't able to get services because they couldn't get their documents together in order to get Medi-Cal. And so they asked, is all that they had to do is get an affidavit?
Correct. An affidavit can be accepted for any eligibility requirement, basically. So identity or citizenship or income, it is the last resort. But usually, you need to work with the county for the county to realize that needs to be the last resort. Because if you're requesting it, but then you're hitting up on your timeline, the county might not realize that you don't have the documentation available or anything like that. So I would suggest definitely for those instances to really work closely with the county, especially if they're having issues getting documentation.
Thanks, Catherine. Any questions? Yes, Lily.
I just wanted to jump back in, Catherine, I did attend the DHCS. It was another webinar earlier today on the 26th through 49 aged population for Medi-Cal. And just wanted to highlight that I know there was a question about the transition population, and DHCS did provide some scenarios that were really helpful, but just wanted to call out that one of them was, if an individual, is 26 through 40, meets the age requirements, but does not meet the satisfactory immigration status requirement, they can be enrolled in restricted scope Medi-Cal. Let's say they enroll in November. So for November and December, they're in restricted scope, and then they would automatically transition to full scope Medi-Cal on January 1. Just want to thank DHCS for, and actually I'll put the link to the DHCS enrollment and eligibility plan for the next expansion if Riley, you want to share with the attendees.
Thanks, Lily. I think we have about 4 or 5 more minutes that we've dedicated to questions. So feel free to raise your Zoom hand or continue using the Q&A. And would love to hear about your strategies that you've been deploying in your community or your organization to keep folks covered, or any barriers that you've kind of encountered. Please continue to provide those to us. Someone asked, you can have Medicare and Medi-Cal together, correct? And yes. Go ahead.
Yes, I believe those patients are referred to as Medi-Medi, right, Catherine?
That is correct. You can have Medicare and Medi-Cal together.
And someone said you can also have employer coverage and Medi-Cal.
Correct. Medi-Cal will always be what we refer to as the payer of last resort. So the employer coverage will pay for any copays or whatever first, and then Medi-Cal will pay what the employer sponsored coverage will not pay.
I thought I saw a hand pop up earlier, but I might have missed it. Someone wrote in the chat, we've been running into the issue of Medicare Part C bumping people out of their regular system of care through Medi-Cal. Our clients are getting signed up without realizing it. Then we have a question, isn't there a limit on how much income you have to have employer and Medi-Cal?
There is no income limit for having employer sponsored coverage and Medi-Cal. Medi-Cal has an income limit, but having other health coverage, there's not a particular limit or anything tied to that coverage. I hope that answers that.
And Julie, I see you typing a response to this one, but wondering if it's worth reading out loud. Someone asks, what happens if we come across someone who is experiencing homelessness? But I lost the question, sorry.
Sorry, that's my fault. I'll grab it for you. Sorry about that. What happens if we come across an unhoused person, but they make more than the minimum requirement? Is there any other type of programs for them? And I wrote back on this that Covered California is there for folks who are over income for Medi-Cal. And they can get, oftentimes they're eligible for pretty significant subsidies so that they're paying very little toward premiums, especially if they were formerly on Medi-Cal. And they're on the edge, and that the subsidies go up to pretty high income. I think small subsidies that they get close to the top of 400% of the federal poverty level, but pretty significant subsidies when they're between 138% and probably like 300% of the federal poverty level. So it can be a really important program to apply for and see what those subsidies would be. I'll put the link in the chat also.
Thanks, Julie. And then someone asked, what is the best way to connect someone in Medi-Cal who's experiencing homelessness and is also undocumented?
Catherine, do you want to take that, or do you want one of us?
Sure. I'll start and then you guys can fill in anything else additionally. I would definitely recommend making sure they connect with their local county office, because that's going to be the biggest resource for them to make sure that their case is updated. If they have one already, if they haven't, they don't have a Medi-Cal case, then they can apply either in the office, or they can get an application sent to them, or certain organizations will just have applications for them to fill out, as well as applying online as well. And that'll get them connected to the county they best reside in, because I know that's not always super clear to individuals experiencing homelessness. Is unfortunately eligibility is tied to counties, and sometimes they may move from county to county just depending on their life circumstances.
Thanks, Catherine. Did anyone else have anything to add for that response? All right. Well, thank you all so much for asking your questions. We'll continue to just kind of respond in the Q&A. I'm going to go ahead and pass it to my colleague Riley so she can have time to kind of talk about next steps and close out this call today. Thank you so much.
Great. Thank you all. Thank you, Carla, for facilitating that Q&A, and everyone else who helped chime in and answer the questions. This is kind of like a record-breaking, I feel like, Q&A I've ever seen on a webinar. We've answered help answered 67 questions. So that feels good. All right. So before you head out, just want to say we hope this presentation demonstrated to you all the importance of renewals and the actionable steps you can take to prevent loss of coverage for people experiencing homelessness, and just also so you are better oriented with the policy around this renewal period. The recording of this webinar will be posted to the same webpage as our Homebase toolkit, probably by the end of the week for anyone to see, hopefully sooner than the end of the week. The first thing we want you to do after this presentation is open up our toolkit if you haven't already. Read more about how to help yourself renew or how to help clients renew if they are current Medi-Cal members. The toolkit is on the Homebase website. I'm going to share the link again. But just so you know, if you ever lose track of it or you want to share it with someone, you can go to the Homebase website and look under the tab for resources, and there's a Medicaid page there. You can share this toolkit with coworkers, friends, families. There's really no one that will not benefit from hearing these messages. And the toolkit is currently being translated into Spanish and hopefully should be up on the Homebase webpage soon. And if you have any questions, never hesitate to contact Medi-Cal at homebasecc.org. We are happy to answer any questions you may have and maybe direct you to a local resource who may have be able to answer your question better than we can. But we really want to stay informed and stay connected to you all throughout the next year. We really, really would appreciate if you tell us your stories about how helping people experiencing homelessness complete their Medi-Cal renewals is going. And we can continue to share this feedback with DHCS. And those informing us about how it's going and your feedback about Medi-Cal renewals, you can share that via email. And I'm going to share the email in the chat one last time. But there's also another opportunity for you to share your feedback with us, and that's going to be office hours. Homebase is planning to host regular office hours to answer questions you may have, but also you can join to learn from what other communities are doing, or you can come and share what is and isn't going well in your community. The first office hours is scheduled for October 11th, next week, from 1 to 2 p.m. Pacific Standard Time, and the Zoom invite will be provided in a follow-up email. So after this call, we are going to send a follow-up email to everyone who registered for this webinar. Like, even if you didn't attend, as long as you registered, we have your email, and we're going to provide some of the many links we shared in the chat today. I know it's probably was hard for you to keep track of. So we're going to leave you with some final thoughts to make sure you feel like you have enough resources to stay informed. In that follow-up email, there's also going to be an option to opt out of email updates from Homebase regarding our Medi-Cal renewal outreach campaign. But we're hoping many of you will want to continue receiving email updates from us, not just about this webinar, but about maybe updates to our toolkit that may be happening. We can inform you about policy changes. We want to be there to keep you informed. And that kind of brings us to the end of our webinar. I want to thank you all so much for joining. We are so pleased with the turnout and enthusiasm for this campaign thus far, and it's a really important issue. But given how many questions were asked, we can really see that your communities on this call today really are ready to step up and help people. Thank you again to all our guest speakers for making time to be on this call. And a special shout out to my Homebase team for getting this campaign moving at lightning speed. We're at 2 o'clock, but if anybody else wants to jump in really quick and say anything before we end the call, please do so. All right. Well, thank you all for joining us. Be on the lookout for our follow-up email, and have a great rest of your day.
Thanks so much.
Thank you.